Descriptions of the human body assume the person is standing upright with arms at the sides and face forward, a position known as the anatomic position. The median sagittal plane divides the body into equal right and left halves. Structures closer to this plane are medial, while those farther are lateral. Coronal planes are imaginary vertical planes at right angles to the median plane. They help in understanding body orientation. Horizontal or transverse planes are at right angles to both median and coronal planes, assisting in body sectioning. In describing relationships, one structure can be anterior or posterior based on which is closer to the front or back of the body. The terms proximal and distal indicate distances from limb roots, while superficial and deep describe distances from the body surface. Internal and external refer to distances from the center of an organ. For example, internal carotid artery is within the cranial cavity.
The terms internal and external describe a structure's distance from the center of an organ. For instance, the internal carotid artery is within the cranial cavity. The external carotid artery is outside the cranial cavity. These terms help in anatomical orientation. Ipsilateral means the same side of the body, like the left hand and left foot. Contralateral refers to opposite sides, like the left eye and right ear. The supine position is lying on your back, while the prone position is lying face down. These terms are vital for understanding body orientation. A joint is where two or more bones meet. Some joints allow no movement, while others can move freely, like the shoulder joint. Flexion occurs in a sagittal plane, like bending the elbow. Extension straightens the joint, usually in a posterior direction. Lateral flexion moves the trunk sideways. Abduction is moving a limb away from the midline, while adduction brings it closer. Rotation occurs around a long axis. Medial rotation faces the anterior surface medially, while lateral rotation faces it laterally. Circumduction combines flexion, extension, abduction, and adduction. Inversion and eversion relate to foot movement. Protraction is a movement that causes the jaw to move forward. Retraction is the opposite. It describes the jaw moving backward. Both movements are crucial for the functioning of the temporomandibular joints. Understanding these movements helps in diagnosing jaw-related issues.